First off, my name is Ethan Crawford. I'm the Get Ready campaign intern with the American Public Health Association, and I have a couple questions for you. I'm also here today with.
I'm Tracy Wharton from NNPHI.
Okay.
Dana Rosenburg from NNPHI.
Perfect. I first want to start asking you about how did you get into the role of advocacy work?
I'm trying to remember if there was a start to that. I'm a social worker by profession, we were just saying, and so injustice anywhere is it's that, right? I don't know. How did you get into advocacy work?
Yes, similar to Tracy, I came into public health by way of nursing, and so I was a nurse first, and I worked with a lot of patients who were receiving chronic disease-related transplants, so kidney and liver transplants, and the people I got to know as patients, being an advocate for them in the public health system when they're stuck in the healthcare system has been a joy to work for them.
Yeah, I think, very, very similar. We're both into healthcare access, and so this issue of access, that everybody should have, equitable access, and the idea that we live in such a wealthy nation and there are people who cannot access basic healthcare is just not right. We need to fix that.
So you have the passion behind it.
Oh, yeah.
So how does this passion embody the goals of your organization today?
Oh, see, he's putting us on the spot with this one. I can't speak for my colleague here. I came to work for NMPHI because the mission very much aligned with my values. My work, I've spent many years working hard in my career to make sure that my values align with the work that I do. And so it was really important to me that I work for a place that lives up to that. No place is perfect. We all are a work in progress, but I think, my colleagues, we've grown a lot in the past few years, and I think my colleagues really try hard to embody those kinds of values.
Yeah. Being at NNPHI, getting to build like a public health system and public health workforce and public health systems for future generations is just a big motivator, and being part of the solution. Like, we all see the problems with public health and how the system hasn't been supported and how we can change that, and that's really motivating at the end of the day.
Awesome. And I have one last question. What advice would you guys give somebody else who is interested in getting into the role of advocacy work?
I think I would say find people that are also passionate about the same thing you're passionate about, and don't try to reinvent the wheel. There's probably somebody who's already doing it near you, and you just need to get tied into those things and support others doing that work because there's strength in numbers.
That, and also I think I have two pieces of advice. One is don't be afraid, and remember your why. When you remember why we do what we do, when you remember what it means and why we do what we do, it's easy to be less afraid, because being an advocate can be scary. We're advocating for change, and people who advocate against also have a right to engage in that dialogue, and it can be kind of scary and intimidating. So don't be afraid, and remember why you're doing it.
Lots of great advice. Well, I appreciate you doing the interview.
Thank you so much. Thanks.
Of course.
Yes.